And for now, our next presenter is Clément Baudelaire. He's gonna talk about Nabla.
I'm Clément Baudelaire, and actually I'm here because I stand in for Alexandre Lebrun, our CEO, who can't make it tonight, unfortunately. So I'm not a doctor, some of you guys. I am actually an engineer, and I work as a product manager at Nabla. And so we'll just share some 3 slides just to have something. Let me share my screen. So you should see my screen now. So for those of you who missed Nabla presentation last Wednesday by our CEO, Alexandre Lebrun, Nabla is a French startup that offers a complete set of technological modules for patient engagement at scale. And the story of Nabla is kind of interesting because Nabla was created 4 years ago, and we have operated a primary care digital clinic for 2 years in France and in the UK with more than 25,000 patients. And what we do now is that we offer the very same set of technologies that we needed to operate our own clinic, but this time to other digital clinics and telehealth providers. And so when I say technologies, I'm really talking about messaging, so that you can enable asynchronous care. I'm talking about video consultations, scheduling, and of course EHR. And all these modules are built together at Nabla to be used together to operate your clinic. They are available through APIs, through mobile SDKs, and in a web app for healthcare professionals. And I think one of our key differentiators at Nabla is our machine learning capability that we leverage to give what we like to call superpowers to practitioners when they use our product. And today I will demonstrate one very specific example of a superpower product that is simply called Nabla for Chrome, Chrome being the browser that we all know, right? So Nabla for Chrome, simply said, is a painless medical notes solution for healthcare professionals. So painless medical notes solution for healthcare professionals. And in details, Nabla for Chrome automatically suggests a live structured note during your video consultation as a healthcare professional and as the consultation happens. So you can dedicate your full attention to your patient and not to your keyboard or to your computer. So in details, Nabla for Chrome summarizes and structures your video consultation in one click. It's not really a dictation tool. It's not a text expander that some of you can use in your daily practice. It's not a template tool, and hopefully it's better than that. So you can see the live transcript of your video consultation when you use it. You can generate a medical note, you can review it, and then copy it to your own EHR just in one click. Nabla for Chrome works with any video consultation solution running on Chrome. So it works with Teladoc, Concilio, Zoom Web, Google Meet, Doctolib in Europe, which is kind of strong, and many more, as long as your video consultation solution runs on Chrome. So for now, it's desktop only. So it's meaning it's only on a computer, and we have a mobile version coming soon. And last but not least, and then I will switch to my demo, it's secure and compliant because first, the audio, the transcripts, and the notes are never ever stored by Nabla. So they are all destroyed every time your consultation is over. We are HIPAA and GDPR compliant. And finally, we use data de-identification and obfuscation to hide any personal information that could be contained either in the transcript or in the note itself, right? So it's a very simple thing. Here, for example, I actually can just click on this little N here, and it will launch this this very small extension here that I can drag on my screen. You can imagine that behind there's your video consultation solution. I can just minimize it so it doesn't hide your patient. And for the sake of today, because the time is very limited, I will show you actually a recorded demo of this extension working live, so you can figure out how it works. So I will be the doctor, and you will see a patient in front of me. And little disclaimer, as I said, I'm not a doctor, so the medical content of what this demo is really for illustration purposes only. But you will, I think, hopefully you'll better understand what we do. So let me launch it, and I will put it in 1x5x so that we can be in time, and maybe if I run out of time, I will just skip the end so you can see the final ones.
Hello, how are you today?
Hello, doctor. I'm okay. How are you?
I'm fine. So did you see the weather today? It's kind of warmer. I mean, it's raining, but it's warmer.
Yeah,
right?
yeah. It feels weird for end of December, but it's quite rainy.
Yeah. And how's the family doing?
Okay. Some of them are a bit sick with COVID, but other than that, it's fine.
Yeah, like old people right now, right? So what brings you here today?
So I'm not feeling very well. I feel very tired all day long. It's hard to be focused when I'm at work, and I can't wait to go home to have some rest.
All right, I see. When did it start?
I'd say 3 months ago. Actually, 4 months ago. Last April, if I recall correctly.
Okay, I see. Any unusual pain or discomfort somewhere?
Yeah, I have some headaches at the end of the day.
Hi.
Back of the head.
On the right side.
Okay. And how about the intensity of the pain?
Very mild, but still, it does not help me to recover after my workday.
All right, thank you. Any major past medical or family history that I should be aware of?
Yeah, I have high blood pressure and my sugar levels are not great. Also, my mother has type 2 diabetes.
All right. Indeed, I see that your last labs show that you have blood sugar level that is 1.4 gram per liter, which is kind of high for your age. And also you have LDL cholesterol equal to 2 gram per liter, which is a bit high again for your age. Any allergies?
Not that I.
So let me just skip a little bit so you understand that it lasts 3 minutes, but let's go a bit towards the end of the consultation. So at the end of the consultation, we are just talking about having an appointment together.
Another consultation together for the 10th of January to discuss the result. Does it work for you?
I'm out of town on the 12th, on the 10th, but the 12th is fine.
Right. So okay, let's do it on the 12th then.
Great. Thank you so much.
Cool. Thank you. Bye-bye.
Bye.
And so now the consultation is over. So as you heard, this patient had sleep issues and that headaches and fatigue. And basically the doctor says that this is maybe related to her sleep, and there's something to dig in, and the doctor wants to order a home sleep test to better understand the sleep patterns and see whether or not this can explain the fatigue that the patient has. And so now that the consultation is over, the doctor can just click on generate a note, and you will see that a note is generated at the end of this consultation without the doctor having to type anything on his keyboard.
Yeah.
Straightforward, pretty good.
I will generate the note now. I'm waiting for the note.
And so you can see here that the note is structured with a classical SOAP note structure with chief complaints, the symptoms, the history of present illness, and the system correctly identifies the fatigue and headaches that were mentioned by the patient, correctly identifies all the symptoms that were mentioned, the tiredness, difficulty focusing, headaches on the right side of the head. The history of present illness is also correct. It could correctly catch that it has been happening for the last 4 months. The past medical history is also correct. There is high blood pressure and high sugar levels, as I was mentioning when I was talking as a doctor. Patient mother has type 2 diabetes, which is also correct. And this is also written here in the family history.
This is my note here. So fatigue and headaches on the right side month here. The sugar level. So it's kind of great.
And here you can see also that there were some lab results. The blood sugar level is correctly identified to be 1.4 gram per liter, and the LDL cholesterol equals to 2 gram per liter. There were no allergies, no current medications mentioned, no vitals, no immunization whatsoever. And this is the final note, and I can just simply copy this note and put it in my EHR to have a good documentation of my consultation here. So let's get straight to here. This is basically it. I hope it was helpful and you could understand what we were doing. this is my email. So, if you're interested in what we are doing, we'd love to hear your feedback. And, we just launched it. So we are running some experiments with doctors, with real life consultations and video consultations to make sure that what we are doing is great and, has some value for doctors. So if you're actually interested, you can reach out to me. This is my email. It's very simple. It's just clem@nabla.com, and I would be very, very happy to talk about it with you if you're interested. And thank you very much.
Thank you, Clément.
Clément, thank you so much for that presentation. And also, it's kind of cool to see you just step up and throw down the pitch like that. That demonstrates good team flexibility. It was neat to see that. I have a question for you in the area of basically AI taking notes for doctors. Recently, I've seen companies getting funded for an idea that seems very similar to this. So my question is, from intellectual property to trade secrets to momentum, how do you sort of differentiate yourself as a good competitive offering against other tech that seems to be very similar?
Yeah, so I think our point of view is that we have seen the progress of machine learning in the recent years and the recent month actually in NLP, so natural language processing. In particular, sorry, large language models are more and more used by everybody, and lots of companies are using them to do stuff. So what we think at Nabla is that this ML technology is actually going to be more of a commodity than anything else, and so we at Nabla differentiate by all the things that go around this and go around this technology that is going to be a commodity in our opinion. So the user experience, making sure that the product that we're shipping is actually useful in a real life video consultation or consultation, and also this has to be plugged to the whole ecosystem of modules that we have that I have briefly presented at the beginning of my presentation. This is something that is part of a whole set of modules that are needed to do proper care and to bring joy to the practice of care for physicians. So it's really not I think the ML part. I think it's the UX. It's also the data that we have and that we collect. Large language models that are more or less public are not specifically trained for healthcare and for medical consultations and for medical notes. So there will be also a reward for the companies who are able to gather a significant amount of data, whether it's actually audio from consultations, transcripts, or real life notes from doctors.
Thank you very much.
Welcome.
The question, how much is there a learning curve, or is it really just sort of a natural back and forth between the doctor and the patient, or does the doctor have to structure the questions in such a way to really pull that information into the note, or is it however your conversation goes, it's able to pull that information into the note without really having to follow a certain script?
Yeah, really good question. So our aim is really not to change anything in the workflow of physicians and doctors. So we really don't want them to change their habits and change the way they do medicine so that our product can work. So then they can just basically have the consultations as they want, and this is our job to actually fit to these various types of consultations and various types of providers. So no, to answer your question, they can carry on with what they do, and hopefully we're good to capture what's relevant and structure the medical information.
And then obviously over video, it's a little bit limited in terms of a physical exam, but is there the capability to add a physical exam section if you do some sort of over the video chat exam?
Yeah, so there's a free text section where you can actually put anything you want to make sure that it's kept here. And also there's, not in this version, but we're working on a way to easily edit anything that were suggested by the extension. We really want the doctor to be helped and be in control of the note, and we're just here to suggest something and to so she can focus more on the patient, but she can write anything in the notes on top of what we're suggesting.
And then final question, any reason to limit it to video chats? I know it's a Chrome extension, but is there a way to take that same technology and plug into an EMR? So if I'm in the office, I can use it there as well, or is it really just focused on video visits for now?
Yeah, so this is a very good question, because we ourselves has had to ask this question to make sure that we're going on the right track. So, you know, to demonstrate value, we prefer to have a very precise product and then expand it to other stuff. And we think that video consultation is actually a very good playground for us for two reasons. First, the audio quality is actually good because, you know, you're talking to a computer on both sides, the patient and the doctor. So the sound quality is good, versus when it's in person, you know, there could be an examination that is far away from the mic. And then you need to think about, you know, the hardware, maybe a mobile app to make sure that the sound is correctly captured and so on. So there's lots of difficulty to capture a good quality sound, which are absent when you're doing video consultation. And the second reason is that an important thing here to master is the ability to distinguish what's the patient is saying versus what the doctor is saying. It's called diarization. So the ability to say, okay, this is the patient talking and this is the doctor talking. This is very important to write the note in the end. And for video consultation, it's actually built in because, you know, there are two different mics. So it's by design, it's very well split. It's perfectly split. But when you go to the in-person consultations, it's very hard to do because you have only one mic, and then you need other technology to make sure that you know who is speaking. So this is why we took this road. And obviously our plan is that if we are, if we demonstrate, you know, impact and traction on this product, we of course want to go to the physical side. But we first want to make sure that we have a great product for video consultation and then expand from that.
You mentioned impact and traction, and I know that you said that you are operating in France and the UK with about 25,000 patients that this has been used on so far. What kind of impact have you seen from that? And what is your plan to kind of make this product available in the US?
Yeah, so actually for when we had our to be really honest, when we had our own clinic, this product was not ready yet, unfortunately. But our first, you know, test internally lead to a conclusion that, you know, the physician can save up to 50% of her time, you know, documenting the consultation. So that's encouraging, and we want to go in that way again. And to answer your question about the US, I think as long as, you know, you use, first of all, as long as you use a video consultation solution that works on Chrome, you know, whether it's in the US or not, it works. And then there's the question of integrating with EHR.
Yeah.
And this is something that we will do maybe in a second time, you know, because I mean, for now, the integration is made by the physician who does a copy and paste. This is a kind of a very cheap integration, right? You just copy paste. So that's why for now, we just stand here. But you know, if the value is here and we have traction, then we will definitely need some more deeper integration with other healthcare software to make sure that you know, this is very flawless extension that doesn't break the.
Yeah. I think if something like this truly could save a physician 50% of their time, because documentation time is such a pain, that could be a real game changer. And that's pretty amazing. What's your business model look like? What are you charging? Are you charging by practice, by patients that use it? What's your business model look like?
So for now, for this very specific product, it's completely free because it's a very alpha and beta phase, but the whole stack of modules that we have behind is basically a price per digital clinic, depending on the number of active patients that you have. So we have several price plans depending on the number of patients that you have. It's not a business model per practitioner, for example. This is a bit different from other softwares. It's really what interests us is the number of active patients that you have in your system. Yeah.
Great, thank you.
Welcome.
Thank you, Clément. So I use Epic and I used Cerner before, so they're both working on something. But for now, we have Nuance, so it's just voice recognition and, you know, it's typing whatever we say. But your product seems to be a step ahead, pulling out from all that text, just the important information. So it's very interesting. Thank you for the presentation. Thank you.
Thank you.